How scoliosis affects breathing. Scoliosis doesn't just affect the spine, it also changes the rib cage, especially with thoracic and thoracolumbar curves. As the spine curves and rotates, the ribs on one side move backward and outward, while the ribs on the opposite side become compressed and restricted. This can lead to an uneven chest expansion, one lung having less room to expand, and overall reduced breathing efficiency. It's important to know that this is mechanical and not a lung disease. The lungs themselves are healthy. They are just working with less space within the chest cavity. Breathing changes in scoliosis are about structure and movement, not lung damage. Breathing difficulties are more likely when the curve is in the thoracic region. The curve is moderate to severe, the rib rotation is significant, or the scoliosis is long-standing or degenerative. However, even mild curves can affect breathing efficiency, especially during fatigue or exercise. That's why breathing symptoms don't always correlate directly with curve size alone. Not everyone with scoliosis experiences breathing problems, but there are signs to watch for. Shortness of breath with mild activity, feeling unable to take a deep breath, chest tightness or pressure, asymmetric chest movement when breathing, fatigue with exercise, and rib discomfort or chest pain are all potential indicators. It's important to first rule out heart or lung conditions. Once those are excluded, scoliosis-related mechanics are often the explanation. Rehabilitation strategies can make a significant difference in breathing. Scoliosis-specific breathing focuses on expanding the compressed rib side, improving chest wall mobility, derotating the thorax, and increasing overall breathing efficiency. Targeted physiotherapy includes thoracic mobility work, postural correction, core and trunk control, and integrating breathing into movement. Programs like ScoliBalance and Schroth-based methods place breathing at the center of treatment rather than as an afterthought. Modern 3D braces can also support better breathing. They don't just hold the spine in place. They improve trunk alignment, reduce rib compression, and support a more balanced chest position. In adolescents, braces can guide growth to preserve rib mobility. In adults, bracing focuses on posture support, reducing fatigue, and improving comfort during standing and walking. When the rib cage is better positioned, breathing often becomes easier. Breathing-focused rehab and bracing can improve breathing efficiency, reduce chest tightness, increase exercise tolerance, and help posture-related breathing restriction. However, they cannot instantly increase lung capacity, nor replace medical care for heart or lung disease. Breathing improvement is gradual, functional, and progressive rather than dramatic or overnight. Breathing changes from scoliosis are real and often overlooked. The good news is that with scoliosis-specific rehabilitation and modern bracing strategies, breathing comfort and efficiency can improve meaningfully. At ScoliCare, breathing is treated as part of the full scoliosis picture, not just a symptom. When the spine and rib cage move better, breathing usually follows.